Hi there, my name is Angelika. Thank you for joining my presentation for the MBA Business Strategy course at Bethel University. Today, I'll be analyzing the healthcare industry and presenting a complementary divisional strategy for the Mayo Clinic, one that builds upon its existing bold, forward, unbound vision while addressing current deficits and emerging opportunities. Here's a quick overview of today's agenda. First, we'll explore an industry analysis and apply Porter's five forces. Next, I'll review a SWOT analysis highlighting core competencies and weaknesses. From there, I'll walk through the Mayo Clinic's current business model and introduce a refined divisional strategy. We'll finish with an execution plan, expected benefits, and a brief conclusion. Healthcare is a vast industry with many providers, payers, and pharmaceutical companies and digital platforms. Demand stays high due to chronic conditions, aging populations, and increasing health awareness. The industry's goal is to improve the quality of life through prevention, diagnosis, treatment, and end of life care. Today's patients want personalized, holistic care supported by digital tools and transparency. Many patients prefer integrative options, such as naturopathy, wellness programs, and digital tools that promote long term health over quick fixes. Meanwhile, the industry faces challenges like rising costs, workforce shortages, and declining public trust. Applying Porter's five forces gives us a clear picture of the industry's dynamic situation. Threat of new entrants such as digital health startups, IV hydration clinics, and retail health services like CVS Minute Clinic challenge traditional care models and make healthcare access easier through direct to consumer models. Entering this field requires significant capital due to regulatory, legal, infrastructure needs, and therefore poses a moderate threat. Suppliers have a higher influence on the industry as well due to labor and supply chain issues such as labor unions. Buyers are increasingly empowered with great demand for digital and affordable options. Online reviews and choices have empowered the buyers. Threat of substitutes can range from AI apps to wellness centers that are also reshaping our consumers' expectations. And finally, industry rivalry is intense among other hospitals, as well as urgent care centers, insurers, and retail health brands. To compete and stand out, healthcare organizations must invest in innovation and branding. This SWOT analysis outlines Mayo Clinic's position within the broader healthcare industry context. Strengths include robust demand, technology, and infrastructure. But challenges like high costs and clinician burnout, as well as those declining patient trust rates, they fell from 71.5% in 2020 to 40.1% in 2024, according to Blendon, and that's my references. Opportunities lie in integrative health, which has seen significant growth with the use of complementary approaches, which have increased from 19.2% in 2002 to 36.7% in 2022. And that's from Naheen 2024, also in the reference section. Other opportunities for advancement include the expansion of mobile clinics and nurse led care, complemented by physical therapy and health coaching, as well as the growth of data analytics and predictive analytics. Meanwhile, policy shifts, cybersecurity risks, and new market disruptors like Amazon Care pose external threats to the hospital industry. According to Forbes, the Mayo Clinic's total revenue for the 2024 fiscal year was 17.9 billion, while its expenses were 15.7 billion, resulting in a net income of approximately 2.2 billion. Mayo Clinic's business model value proposition centers around providing patient-centered care extensive research, and a multidisciplinary team approach through a world-renowned hospital system. Mayo Clinic's strong customer relationships are based on patient trust, built on years of medical outcomes relayed through their multidisciplinary team. Customer segments include patients seeking complex medical care for rare diseases and health conscious individuals seeking preventative care. Mayo's distribution channels include existing Mayo Clinic campuses, referrals from the primary care providers, and digital ads, corporate partnerships, and the Mayo Clinic website as well as mobile app. Mayo's revenue comes primarily from clinical services, direct patient payments, insurance reimbursements, donations, real estate, and partnerships. Let's look at the backstage of the organization. Mayo's cost structure includes clinical staff salaries, facilities and maintenance, new technology implementation, supplies, marketing and partnerships, and regulatory and compliance costs. Critical key activities include that clinical care delivery across all campuses, research and innovation, education, partnership development, and global expansion. Key partners include academic partners, pharmaceutical and medical device companies, insurers, and tech partners. A key asset in Mayo's research is Mayo's research database and intellectual property. Other key resources include Mayo's lab testing capabilities, its global facilities, top-tier staff and researcher, as well as clinical expertise. Even at the number one hospital, the purpose of this presentation is to show that there's always room for improvement based on market expectations and changes. As holistic and alternative medicine practices continue to rise, Mayo needs quicker ways to incorporate them. To evolve Mayo's strategy, I propose integrating holistic medicine with traditional care through hybrid wellness programs. Additional services may include IV nutrition or hydration therapy, as well as those anti-aging packages and preventative care in more accessible retail style formats. I also recommend leveraging wearables and AI tools for monitoring health and improving patient and provider relationships through digitization strategies, which would reduce those in-person visits and allow providers to see more patients at a time. Partnering with device makers and holistic partners would also support this scalability. To implement this complementary strategy, we'd begin with a pilot program at one location. It could be Jacksonville, Rochester, or Scottsdale, where we would be testing these subscription wellness services and naturopathic recommendations. We could run A and B tests to assess patient satisfaction and the ER visit reductions, as well as patient engagement and adherence to their care plans across different patient population groups, including newborns and pediatric patients, as well as adult and geriatric population segments. Strong execution requires clear accountability, performance metrics, of course, training, and regular leadership check-ins to assess the impact. This new strategy creates 4 major impacts. First, on the low end disruption, offering affordable self-pay packages, including telehealth visits, lab tests, checkups, chronic disease management, preventative care, mental health support, and urgent care at transparent costs. These straightforward care packages target those who can't afford traditional healthcare, aiming to disrupt the system, build trust with underrepresented groups, and test direct-to-consumer plans, as well as fostering that social change around healthcare and exploring service expansion. Second, new market expansion may be possible with multilingual interfaces in Spanish, Somali, Hmong, and Mandarin. These mobile-friendly AI-powered clinics will provide 24/7 health checks, triage, booking, and referrals. We'll partner with community centers and churches for digital literacy support. This strategy expands our customer base, improves population health, and positions Mayo Clinic as an inclusive, innovative leader. Third, sustained innovation is possible through ongoing professional development by providing healthcare providers with access to the latest technology, as well as protocols and evidence based practices. This may include provider training, university partnerships, and tools for applying evidence and gathering patient feedback, ensuring our services remain competitive, precise, and responsive. And finally, efficiency gains via AI triage systems to support clinicians and reduce wait times, and decision support tools will make care faster and more efficient. As we learn throughout this course, a business truly excels when identifying both the right environment and the right capabilities. The healthcare industry is at a crossroads. Patients want more than just treatment. They want transparency, access, and long term health solutions. Mayo Clinic is well positioned to lead by integrating holistic and digital care, expanding access, and restoring public trust. Strategic innovation can help Mayo shape a more responsive and empowering healthcare future. Thank you. These are my references and contact information. Thanks again.